The grave of Lucy Aluka is being constructed in Kidotok village, Ogangai parish, Pingire sub-county in Serere District, where she was laid to rest. Relatives and friends are still trying to come to terms with her sudden death. Lucy Aluka met her death on 23rd January 2025 at Soroti Welfare Clinic, where she had gone to deliver her first child. At the time, she was the District Community Development Officer of Kabera Maido. She reportedly checked in at Soroti Welfare Clinic for scheduled surgery to be conducted by Dr. Godfrey Egwao and his colleagues. This came about after she was advised that she would not do normal delivery, this being her first pregnancy.
They told her that Dr. Egwao would handle her better. So, of course, she started going there. Because I was always in touch with her, I stay in Kampala. But whenever I would come from Kampala, I would always...
After hours into the theater, the health workers came out with a newborn baby and said the mother was still recovering.
Gladly. Yeah. So, and for me, I'd expected them to bring her also immediately. So when I was there...
After hours of waiting for Luka's relatives, realized that she had not been brought out of the theater and started demanding for her. After hours of waiting, the medics told the family to leave the room which had been allocated to them for treatment because they were bringing in Oluka for more recovery.
So they were now busy. They had put for her drips. In fact, the drips were running very fast, 2 to 3. But running very, very fast. When that one gets finished, they would put another one. So in the process, we asked her that, but at what time is she waking up? They told us that, we cannot tell because they differ. Some wake up early, some can take time. Entered inside. Okay, me, I don't know. That one we did see really whatever. But now the head of the late was facing the what? Facing the wall. They put her in a way that we can't see her. We can't see her, and they had whatever 2 drips. So they continued giving the drips.
They waited until one of them touched the lifeless hand of Aluka.
Felt my niece's hand, and I just, not that I wanted, I don't know how. I felt the hand and here. Then I shouted, I said, but why is her body what?
They ran out of the hospital but then discovered that Dr. Gao had taken Aluka's remains to a nearby mortuary run by a funeral home.
Inside. But now, I started knocking. I said, no, you come and tell us what is not happening, what? So it was around that time when my sister now comes. She came and told me that, Marjorie, these people have lied us for a long time. Lucy is no more. The body has become stiff. She's dead. So that is the time we started.
Funeral home. We stopped from picking the body. They were told that you are not the ones who brought this body here. So it is the doctor who will authorize us to give out the body.
The relatives sought for a postmortem report contacting the nearby regional referral hospital, but the family said no one was willing to help.
Not seen doctor. They kept on calling doctor. Doctor's phone was off. Yes, who had agreed, who had told us to transport the body. So when they stayed almost for an hour. Doctor came. When the doctor came, he entered in the theater, left them outside. Afterwards, doctor said, no, I cannot do this postmortem.
The relatives eventually obtained a postmortem report from regional police surgeon in Mbale, which revealed that Lucy died from severe postpartum hemorrhage. Police spokesperson Kituma Rusoke confirmed that Dr. Godfrey Gao had been apprehended and later secured a police bond, with investigations now underway.
Clinic to Bethesda Hospital mortuary, and then he did the body treatment, and then they allege that thereafter he switched off his phones. So there was a breakdown. They raised concerns, and police, we took it on.
The relatives accused Soroti Welfare Clinic and Dr. Egwao of negligence and withholding or hiding vital information.
Justice, we want justice.
Bleeding during pregnancy is a common condition but can be managed by experts, according to Dr. Henry Kiza, a gynecologist at Mulago Women's Specialized Hospital.
So bleeding after C-section is also actually common, and it is one of the causes of what we have said earlier, that excessive bleeding, that is postpartum hemorrhage. So in this case, like I still said, that bleeding during a C-section shouldn't go beyond 1 liter of blood or more. So anything bleeding of 1 liter or more is considered as excess. Now, so how do we prepare ourselves?
Reliable information indicates that postpartum hemorrhage contributes to about 25% of maternal deaths in Uganda.
The professional bodies like Uganda Medical and Dental Practitioners Council to ascertain, to make sure that the clinics that are licensed to perform these procedures are actually manned by skilled doctors. These doctors should be monitored, not only to offer them operation licenses, but also subsequently to be updating them, their registers, you know.
The newborn baby is currently being taken care of in a center which looks after babies who don't have mothers but require attention. Jomakiria, NTV.